Okay. So thanks very much, Anna, for completing the depression assessment with me. And during that assessment, you mentioned that you've been having some suicidal thoughts. So I want to ask you a little bit about the suicidal thoughts, right? I know that when someone has these kinds of thoughts, it's a sign that there might be problems or pain in their life that they don't know how to solve. And one of the first steps to feeling better is talking about it and is understanding it in a lot of detail. So if it's okay with you today, could we talk a little bit about your suicidal thoughts?
Yeah.
Okay,
Okay.
cool. Thank you. And please remember that if this is really hard for you, if there's anything I can do that could help this be easier for you or to make you feel more comfortable, please let me know. I'm really flexible. And also remember the limits to confidentiality we discussed earlier, right? So, whatever we discuss is private and confidential. However, if there's an imminent danger to your life or to someone else's life, or if there's a child in danger or at risk of being neglected, then I have to make sure that people are safe. Does that make sense?
It does. Yeah.
Okay, cool. And like I said before, but as well, I'll take some questions. I'll take some notes along the way. Okay. Um,
Okay.
so my first question is, have you had these suicidal thoughts in the past week?
Yes. Yeah. I
Okay.
have.
And how often do they happen?
It feels like it's more often now. Like it feels like it's every day.
Okay. And when you have these kinds of thoughts, what do you think about? Like, what's the images that come to mind?
Um, I think just the thought of nothingness or just not having to deal with feeling this way, like a release. Usually I think about just being in my bed and going to sleep and then that's it.
Okay. And when you go to sleep and that's it, is there like any way that you would put yourself to sleep, or is there any particular method that you've thought about trying to end your life with?
Um, Probably with sleeping pills.
Okay.
Um, I usually have alcohol in the house as well, so that's probably what comes to mind anyway.
Okay. And how long have you been having these thoughts for?
A long time. Um, More often in the last, I would say six months.
Okay. And today, do you have any intention to end your life?
No, I don't feel like I have an intention to do it. I think sometimes maybe at night it's worse, and it kind of gets worse at that time when I'm by myself.
Okay. Yeah, that's understandable. Um, on a scale of 1 to 10, how likely are you to try to end your life in the next week?
Maybe like a six.
A
That
six?
makes
Okay.
sense. Yeah.
Okay. And like, do you have a specific plan to do it? Like a time and a place, and like, do you know exactly how that would happen?
No, I don't feel like I have a plan. I think I'd want to be at home by myself in my room. It feels like the only place like that I feel safe right now.
Okay. Okay. And have you ever tried to kill yourself before?
Um, yeah, in high school, I did. I took some pills from the medicine cabinet, and my mom found me, but I didn't tell anyone else.
Okay. And what triggered that? Like, what contributed to that?
Um, I went through a lot of bullying when I was in school, and it affected school and affected everything. And I felt like I was all alone, and my parents didn't really seem to care
Okay.
or didn't understand. And it got really bad, and that's when that happened.
I'm so sorry to hear that. That sounds like such an awful time of your life. I'm wondering, like right now, I see you're getting emotional. I just want to check in with you a little bit. On a scale of 1 to 10, how stressed do you feel right now? 10 being the most, 1 being the least.
Um, Maybe like an 8.
And how overwhelmed do you feel? 10 being the most, 1 being the least.
Yeah, maybe like 8 or 9.
Okay. And where do you feel that in your body? Like, where do you feel the stress and the tension?
Probably in my chest, like my lungs, like trying to breathe.
Okay. So you feel that tension in your lungs, in your chest. Anywhere else, like in your face, in your back, stomach, arms?
Yeah, my hands always feel shaky.
Okay. Okay.
Hmm.
Can I show you some skills and some ways to bring down that level of tension today?
Sure.
Okay. So right now, could you tell me 5 things that you see around you and tell me what color they are?
Um, I see the trees outside, and they're green. The leaves are green. I see the table. It's brown. Um, and sunglasses that are brown. The laptop that's gray. Got 4.
Yeah. And now can you tell me 4 things that you're touching right now and what they might feel like?
Um, my jeans. They feel kind of rough. My arm, it feels smooth. The chair that feels hard. And the floor that feels rough.
Okay. And can you tell me 3 things you can hear?
I can hear the road. I can hear the trucks. Um, I can hear the birds.
Okay.
And I can hear the laptop,
Yeah. And you can hear my voice as well too, right?
and I can hear your voice.
Okay. Is there anything that you can taste right now?
Um, Old coffee.
Okay. And anything you can smell?
Plants in this room.
Okay. And now, could you take 3 really deep, slow breaths for me? And I'll count 5 in and 7 out. Okay. Ready? Breathe in very deeply. 2, 3, 4, 5, and breathe out slowly. 2, 4, 5, 6, 7. Great. Breathe in deeply and breathe out slowly. You're doing great. One last deep breath. Breathe in super deep and breathe out very slowly. Okay. Now, how do you feel?
A bit better.
Okay. Is
Thank
your
you.
stress level still at like an 8 or a 9, or has it gone down?
No, it's down.
Okay.
It's down.
Have
My
you
hands
noticed?
don't feel like they're shaking.
Yeah. Have you noticed any change in your chest tension?
Yeah, it feels like it's loosened.
Okay. Okay, cool. And is it okay to continue on with the assessment?
Yep.
Okay. All right, let's keep going. Um, so in the last month, have you been doing any like risky or impulsive things?
Yeah. Yeah, a bit.
Tell me about it.
I've gone out with friends quite a few times, and I've met up with random people, and I've gone off from the group a couple times with people that I've just met, and I know that's it's not the safest, but I don't feel like I'm worrying about that. I'm
Okay.
not putting myself in the moment. Like I feel distant.
Okay. And do you ever hurt yourself in any way? How
Yeah.
so?
Um, I've been cutting myself more so recently, but it's something that I've done for a really long time,
Mm. And
and it's worse when I'm stressed.
yeah, when you say you cut yourself, like, would you say that you've ever needed like medical attention for it, or are you able to just like clean it up and um, deal with it yourself?
Yeah, I'm. There's been times I probably should have sought help,
Hmm.
um, but I didn't because I was ashamed
Hmm.
and I didn't want to tell anybody. So I've just dealt with it myself.
Okay. And when you cut, is that an attempt to end your life, or is that an attempt to distract from pain or deal with pain, or is there another reason why you cut yourself?
Um, I think it's more of a self-punishment.
Hmm.
It's it feels like it's more to punish myself for who I am
Hmm.
and how I feel.
Okay. Yeah. And can you tell me, like, in terms of other like risky behavior, do you drink alcohol or do you do any drugs or like do you engage in any other kind of high risk behavior?
I do drink on weekends when I go out
Hmm.
or with friends, and that's it's become pretty regular. So that and I do smoke weed like every night, either with friends or on my own, and it does help me sleep.
Yeah. And
Probably why I keep doing it.
does the cannabis or alcohol cause any problems in your life? Like, have you ever had like alcohol poisoning or any other like related problems?
Yeah, I went to the hospital once from drinking too much. Um, my friends took me there. I don't actually remember it.
Okay. And when was that?
About a year ago.
Okay. And do you have any problems with eating or sleeping?
Just sleeping.
Okay.
That's the again, it's the time that I'm by myself,
Mm.
and is the time that I find really hard. So it's hard to fall asleep.
Okay. And do you feel like trapped or hopeless or angry about anything?
Yeah, I feel isolated. Like I like I'm ashamed to talk to my friends, and I don't feel like they know what's going on, or they don't know like the extent.
Mhm.
And I feel like my parents don't care.
Okay.
Like they've never cared, or they just don't know how to care.
Okay.
So I
Yeah,
feel really alone.
sure. And those are areas I definitely want to talk a little bit more about with you as we move forward. I'm wondering, have you been through any experiences of like discrimination or bullying in your life? Like you mentioned some bullying before. When I say discrimination, I mean like because of your identity, because of your gender or sexual orientation or race. Have you experienced any kind of discrimination based on those areas or other aspects of your identity?
Yeah, the main reason that the school was so hard and I was bullied was pretty much I grew up in an all white neighborhood in an all white town.
Hmm.
I'm half Mohawk, and the kids were really vicious with pointing that out and making me feel separate and isolating me. So it went on for a really long time, into high school. Being a small town, it was the same people through grade school on to high school. It was just really relentless. Um, and we didn't really have anyone else that, was of a different background. It was really just me.
Wow. I'm so sorry to hear that. That's so awful. Um, and I definitely want to talk to you a little bit more about that. But for today's purpose, do you think there's any connections between the experiences that you've had, the experiences of discrimination and bullying, and how you're feeling today?
Yeah, I feel that I really took everything to heart that everybody used to say to me and making me feel less than everyone else. And I think it really impacted my self-worth. And I think that's when I started to hurt myself
Hmm.
because I didn't feel like I was worth anything.
Okay.
And it just never got any better than that.
Okay.
And I still have that in my head.
Mm. And I'm wondering, like, I hear what you've been through, and it sounds like you've been through a lot of difficult things. For today, what would you say? Like, I know you've had these suicidal thoughts um, pretty consistently, pretty regularly in the past week. What are your reasons for dying?
Um, I just don't want to struggle anymore.
Hmm.
I don't want to feel like I'm less than anymore. And I don't want to feel alone.
Hmm. Okay. And, it sounds like you have some reasons for dying. I'm wondering if you have some reasons for living as well.
Um, I do, yeah. I have two really good friends,
Hmm.
my two girlfriends. They're everything to me, and we've
Hmm.
been through so much
Yeah.
that they don't really know what's going on.
Okay.
And then my cat,
Okay. What's your cat's name?
thinks.
Oh, okay, okay. And is there anything else that that keeps you going and that makes you feel good?
Um, Being out in nature, I guess.
Okay.
It's what I've been trying to do to try to make myself feel better.
All right. Very good. And is there any other people in your life that help you stay grounded or that you're connected with? Any connections to family or anything else? Anyone else in your life?
Um, as much as I love my mom, we don't really connect,
Mhm.
but she is one of the reasons that's keeping me here.
Okay.
I don't want to hurt her.
I hear you. I hear you. And like, do you have any plans for the future? Like anything that you're looking forward to, anything that you've been planning for?
Ugh, I don't know. I have a hard time thinking about the future.
Fair enough. I know you said you were in school before, right? Um, is there anything in school that you're working on right now?
Yeah, I'm studying psychology.
Hmm.
Um, so I'm having a hard time in my classes right now.
Sure.
Yeah, it's been hard to stay on track,
Hmm.
but I'd really like to finish or find something that I can keep going with.
Okay. Yeah. So it sounds like on one hand, you're really suffering. You're having these daily thoughts of not wanting to live. You have this history of hurting yourself and this history of, trying to overdose. Um, and on the other hand, it sounds like you have some really important people in your life and you have some people that really care about you. Um, and, it sounds like you have some reasons for living. Now, I think it's important to remember that suicide is a final solution to a temporary problem. And the pain and problems in your life, they can get better or they can get worse. Um, and I want to help you, find solutions and find ways to reduce the pain and to have a future that's worth living for. but it's really hard to do when you're having these kinds of thoughts, right? When you're constantly thinking about not wanting to live anymore. Can you hear why I'd be a little bit concerned about you?
Mhm.
Yeah, and I'm definitely worried about like these, when you said that you have a 6 out of 10 likeliness to end your life, right? Um, I'm wondering, like, as we mentioned before, when people have an imminent risk to end their lives, they need to do something to keep themselves safe, right? They need to go to a hospital or develop a plan to make sure that they don't end their lives. Can you make a plan with me today that ensures that you don't act on these suicidal thoughts? And that you're connected to your friends and your mom. So if these thoughts come up or if you have some intention that you have a way of dealing with that.
Okay.
Okay.
Hmm.
Sounds good. Yeah, I want to do that with you today. And I really want to thank you for everything that you've shared with me. I'm wondering, is there anything else that you think I should know about in terms of your suicidal thoughts or self-harm or about your risk to yourself? Okay.
No.
Eh,
No.
Okay. And on a scale of 1 to 10, how overwhelmed do you feel right now? 10 being the most.
Um, I'm okay. Like a 7.
7? Okay. Let's bring that down a little bit more. Tell me about your cat. Tell me about something really funny that Binks does.
Um, he climbs on top of our cupboards. So if you walk in the room, he paws at you, and he hides up there. It's really cute.
Okay. Yeah. And like when Binks is like sitting in your lap and you're petting Binks, how do you feel? Like what kind of feelings go through your body at that time?
Um, Comfort, like happiness. I know he needs me and I need him.
Hmm.
It's nice feeling needed.
Yeah. That's important, right? Like every day you're feeding him, you're taking care of him, cleaning up after him. When you think about that now, where's your stress level? Is it still at a 7?
Wow, it feels lower.
Yeah. Could you
Like
imagine
a,
yourself with Binks in your lap, like petting him?
yeah,
Yeah. So,
it
you know,
helps.
what I want to do is I want to help you develop a safety plan where we develop some coping skills. I want to write it out with you. I want to make sure that you have ways to distract and to bring down the intensity of your feelings when these feelings get to be too much, right? I also want to make sure that we have a plan so that if things get difficult again, that you know exactly what to do so that we can actually deal with these problems moving forward. Obviously Binks is going to be part of that. Your friends are going to be part of that. Your mom's going to be part of that. I'm wondering if you could also book an appointment with your family doctor as well too, just to talk to them about these difficulties that you're having.
Okay, yeah,
Yeah, yeah, and
that makes
also,
sense.
and once we develop the safety plan, can we give a copy to your friends or to your mom just so that they're on the same page and they know how to help you stay well?
Yeah,
Okay.
yeah.
It sounds great, Anna. Thank you so much for your openness and your honesty. I really appreciate it. And so now let's develop that safety plan, okay?
Okay. Thank you. Thanks for
No problem.
talking with me.
No problem. It's my pleasure.